Yes, there we go.
All righty. I can start to share my slides, Dom, if you're ready.
Yeah, absolutely. We should probably start with an introduction of you and I, and then we can get cracking, and I can do some general housekeeping in terms of where to put your questions and when they will be answered. All right. So, welcome everybody. Thank you so much for joining us on this beautiful sunny afternoon in November. My name is Dominique Jones. I'm the Executive Director of the County Foundation. Really pleased to see you all. And I'll turn it over to my colleague to introduce herself.
I'm really pleased at the attendance and your interest in vital signs. I'm Anne Van Vlack. I'm the vital signs coordinator for the County Foundation.
Anne has also been lovingly referred to as head data miner, which I think I prefer as a title, but we don't know if the board of directors would approve that or not. Vital signs coordinator sounds a little bit more official. In terms of housekeeping, so Anne and I are going to go through the presentation, running through the full report. If you have any questions, we are going to tackle questions at the end, but I would encourage you to use the chat if you would like. I'm going to take note of all the questions that come in, and then we'll cover them at the end of the meeting. Don't be shy. If you have a question, I'm sure somebody else does too. And in fact, I think that's one of our favorite parts of these presentations, isn't it, Anne?
It is, absolutely. I'm glad, Dom, you're gathering the questions and you'll summarize those for me.
Absolutely. Yeah, we like to keep a running list of questions that people ask, and sometimes we try and we play this fun game of can we precipitate what questions people will ask, and maybe our reports will be robust enough that we can precipitate some of these things.
Okay.
All right, so we're recording. I think we're ready to go.
Okay. So I had the presentation on the screen, but it's not coming up now. Do you see the presentation?
Yep, I see a main slide, vital signs navigating change.
Alrighty. Well, I will just minimize my screen then so I can actually see it because it's not on my screen right now. Okay.
Flying blind, I like it.
Alrighty. So Don, starting out with you, I guess.
Yeah. So as mentioned, we're from the County Foundation. We're a local community foundation here in Prince Edward County. We've been operating since 2008. And for today's presentation, we are honing in on vital signs, which is a local data collection, a snapshot of the health and vitality of our community. So we've been doing vital signs in Prince Edward County since 2013. So we realized last year that, hey, we have a decade's worth of data. Wouldn't it be interesting to take a look back through the years and see what changes have developed over the years, and also start thinking about how can we precipitate future challenges. So that's really the thesis behind the report. And Anne, as she goes on, if anybody has questions in terms of where stats come from or what the methodology is behind the reports, we're happy to cover that as well. So
Thanks. Thanks, Don.
perfect.
So the just a quick summary of what this vital signs report contains. A brief summary of the data between 2013 and 23, what led us to this point in time, looking also at key socioeconomic and demographic trends during that time, trends and changes, the vital impact of that, and some new announcements about vital impact. This is also acknowledgement and sources. We've had a lot of help to get to this point in time and the call to action. So just a brief overview. So in 2013, the inaugural County Foundation's Vital Signs Report was published, and it highlighted challenges in our community. There were some surprises in that. It highlighted that our graduation rates were lower than the provincial average. The food security rates were high, food insecurity rates, and also the impact of lack of public transportation. So this report was a really good opportunity to reflect on the past, but to highlight some of the emerging priorities and as Dom said, to anticipate possibly future challenges. So this just shows between 2013 to 2023, the various reports that have been published during that time. So it wouldn't be complete to not celebrate the work that's been done collaboratively on these community issues. So that 2013 Vital Signs report, as disturbing as some of the data was, it also spurred collaborative action in our community. So several working groups were formed and supported by the County Foundation and have prioritized and addressed food insecurity, education, transportation, and more recently, some of our economic issues. And so the Food Collective continues to work toward trying to ensure that every person in the county has the means to consistently access and afford nutritious food. The Greater Than County Youth Collective has the aim to raise Prince Edward County's high school graduation rates to match the provincial average by 2026. The Getting Around Transportation Collective has been working on an integrated transportation system for Prince Edward County that's accessible and affordable and responsive to community needs. More recently, Thrive Prince Edward County was formed, and that's looking at a renewed vision for community and economic development. That's community-led. And so that's currently working on a community benefits network, which is working with developers to try to ensure community benefits with these housing developments, and also workforce development. So starting with theme of community, one of the big trends that we've seen is that our population is experiencing growth, and that's after a decade of decline. And if you see the graph, since between 2006 and 2016, our population continued to decline. And then starting from that point forward, you can see that the rate of population growth has been faster since that time. Of the population change and growth, seasonal residents are one of the fastest growing demographics, and seasonal residents currently comprise about 25% of the current population. So that's about 8,400 people. So that's in addition to our permanent population. So also with that population growth, we're seeing a faster rate of turnover. We've had more people moving in, but more people moving out as well. We're also seeing growing racial diversity, and so certainly some changing community dynamics. So shifts in age groups. Now, if you look at the graph on the right, you'll notice that ages 0 to 14 years, our youth population had continued to decrease. It started to stabilize in the last census period, and particularly during the pandemic, we had more families move in. And so that helped to increase our youth population. I hope that that's a growing trend. Of the ages 15 to 64, and that's considered the working age population, that age group continues to decrease. Prince Edward County is projected to have one of the lowest rates of working age population in the province. So that puts more burden on that age range for payment of taxes to support the rest of the population. Our senior population, ages 65 plus, has continued to increase, currently at 34.5% of the population. So just back to that slight increase in the youth population, that wasn't anticipated. And particularly ages 0 to 9, that's where the population increased when more families were moving in during the pandemic. So it's straining the capacity of childcare services and also primary classrooms. We were trying to repurpose classrooms. We were closing primary schools, and now those classrooms are bursting at the seams. And also childcare services. There was never a waiting list in past years, and now the waiting list is over 400. Also, the median age of our population is 16 and a half years higher than the provincial average. So ours is currently at 56.5 years, where the province is 40 years. So that really shows that we're one of the older populations. We have one of the older populations in Ontario and Canada, for that matter. So economy. Looking at, we'll look first at the household income in 2023. That's after-tax income. So the Ontario median income is just over $84,000 a year. That's for a family, household income. The Ontario Living Wage Network shows that a basic living income for a family of 4 in Eastern Ontario is 80,597, whereas Prince Edward County's median family income is 75,573. So you can see that Prince Edward County continues to be not only lower in income than the provincial average, but also in that the income disparities between high income and low income are increasing. And that's a Canada-wide trend. So along with that, affordability has been declining, and particularly with increased food prices, that's really, really putting a lot of more pressure, especially on low-income families. And limited access to childcare has become a barrier to employment. That particularly affects women who might be the primary childcare providers, unable to either work or work full time. So also in our economy, most of our businesses are considered to be small businesses. That's over 99% of our local businesses. They've been under great pressure, and the pandemic certainly added more pressure to that, but they're finding that there's workforce shortages, skill gaps, higher input costs, debt load. Some are still grappling with loans from during the pandemic. And not-for-profit organizations are also greatly affected, finding that they're often really pressured for not having sustainable revenue sources, and there's increased demands for their services. So in that last census period, the rates of self-employment grew during the especially during the pandemic. And Prince Edward County, by the way, has a much higher percentage of those who are self-employed than the provincial average. So that number grew even higher. And if you look at this graph down here, the number of businesses, even with these challenges, the number of businesses that we have overall has continued to increase. So between 2016, 2023, you can see the increase of the blue line is the businesses with employees. The green line is those who are self-employed. So also remote work and working from home have increased, and there's many more tools now. That's maybe that's one of the good outcomes from the pandemic, because we have more online tools now to be able to enable people to work from home. So education, some good news here. Our adult educational attainment has increased over time. So currently, about 91% of our residents, adult residents, have a certificate, diploma, or degree. And that's compared to 85.1% in 2011. So really, that's a really positive sign. Although that could also be influenced by our changing demographics and some of the people that are moving here. And more good news, our high school graduation rates are rising. In 2014, our high school graduation rate, this is 5 years, 5-year graduation rate, was at 74%. So that's only, 3/4 of our high school students were graduating. Now that number has increased to 81.5%. We're still not at provincial levels, though. You can see that provincial level is 89.5% of students who graduate from high school. Also, another trend that's concerning is that skilled trade certification is declining, even though there's been more incentives, scholarships, programs, and so on for people to engage in apprenticeships or trade certification. That number is down significantly. So currently, or as of 2021, 820 people locally hold an apprenticeship or trade certificate or diploma, and that's down from over 2,300 in 2011. So that's quite a decline. So our public school system, our local workforce organizations, and Loyals College are really working in tandem to try to improve those numbers. So more in education, there's performance gaps continuing in student math and literacy. When I say performance gaps, not performing at the provincial level. So that particularly, if you look at the grade 6 standardized testing results, fairly good in reading, writing, but math at 39%. So that's a province-wide trend, is really low test results in math. And so in grade 3, similar, not quite as alarming, math at 56%. So I know that our school board is really working hard to increase those rates of success. And also schools and students are still recovering post-pandemic. There's been a lot of, and I think a lot of long-term effects of the pandemic, and students learning at home, not being socialized possibly in a school environment. Students often aren't dealing socially, not knowing how to deal with conflict. There's lack of motivation for a lot of the students, and lack of attendance. And it's particularly alarming. The rates of non-attendance, especially in grade 8 and grade 12, are particularly alarming for the school board. And early childhood development. And I see, Beth, you in the audience, you'd be particularly, I know, interested in this one. Our conversations were helpful. So early childhood development is shown to have a lifelong impact. So that's not just academic achievement, but it's also in personal well-being. But Hastings Prince Edward has shown in testing of the early development index that there's vulnerabilities for sure in many of our children who are just entering school. So much work to be done there. And alarmingly, Canada ranks 33rd out of 35 OECD countries for early childhood education enrollment. So much work to be done there. Environment. So with so much development, so much change happening, it's really a balancing situation between development and environmental sustainability. And fortunately, residents in Prince Edward County are quite engaged in trying to make sure to protect our environment. So within that is protecting farmland. And between 2006 and 2021, we've lost almost 24% of our farmland. That's to development and aggregate and just not farming those areas. So things that are happening, initiatives to help protect farmland in our official plan by the municipality. There's provisions for protecting farmland. And also the Ontario Farmland Trust is helping local farmers to protect farmland in perpetuity. Any of these things that you want more information on, don't hesitate to contact me, and I've got more details about these. Mitigating climate change, and so our municipality has acknowledged that we're certainly being affected by climate change and is working on reducing greenhouse gas emissions and other incentives. Also safeguarding our water resources, and a lot of attention being paid to that. The Bay of Quinte Remedial Action Plan has made great strides in improving the water quality. That affects, I think it's over 75,000 people that rely on that water source for drinking. And Picton Bay among that is certainly of concern to residents. Also preserving our ecologically sensitive areas. And we're really blessed in Prince Edward County with the natural areas that we have, and a lot of work being done to protect our natural environment. So food security, not good news here. In Hastings, Prince Edward, nearly 1 in 4 households currently lack sufficient food. And so food insecurity is not a food availability issue, it's an income issue. And so the rates of food insecurity, that was one of the things that was highlighted in the 2013 vital signs report. At that point in time, our rate of food insecurity was certainly higher than the province, which is really surprising when you think about it. You know, with the farming community, you think there'd be more access to food sources, but it's about income. So in 2011, about 10.7% of Hastings Prince Edward households lacked enough food. That is now estimated to be about 23%, nearly 1 in 4 households. And that is, again, higher than the provincial average at 17.4, but still alarmingly high. The rise in food prices has been largely responsible for that. And the Food Collective has continued to work on this issue that requires funding and political will and collaboration on the part of the community. But the recommendation is the formation of a coordinated, sustainable approach to food security in Prince Edward County. Food banks work really hard at addressing what is supposed to be emergency food measures, emergency food needs. That has become more of a lifeline, a continuing lifeline for too many people currently. And honestly, the food banks are having difficulty keeping up. So in health, so our primary care has been chronically underfunded for a long time. And the Prince Edward Family Health Team, Verinder, tells me that they just don't have the capacity for the population growth that we're anticipating. And also healthcare staffing shortages have continued to strain the system, and some really great innovative approaches being taken in that regard. So many programs to help attract healthcare workers. For example, Loyal's College healthcare programs. There's now a shuttle, a health pulse shuttle that brings the placement students from Loyal's College to our hospital and to the McFarland home. And our county docs has been very successful. They've been able to attract 7 doctors. It didn't used to be difficult to attract doctors to our wonderful community, but it's become more difficult. There's fewer doctors have been interested in family medicine, for example, and setting up a practice in a rural area has its difficulties and expenses. So these county docs, along with attracting, being able to get 7 more doctors on board, and the need is largely to do with retirements of our current doctors here, but we still need 8 more doctors. And we also need other healthcare workers. So some great innovative approaches with very limited resources have been happening locally. So with that, there's the Doctors Accommodation Network, DAN for short, and that helps locum intern doctor residents to have places to stay. And there's also with the Healthcare Connect, with unattached patients, that's residents who don't have a primary care provider. I think it's been over 750 have now been placed since this past April with doctors. So they're connected now with doctors, and 500 more expected to be connected by the end of this year. Also, a community clinic opened in February, and that's nurse practitioner led. And that is that's helping those residents who are unattached. So some great approaches locally. So in our population, with the large percentage of senior older adults that we have, they face greater health risks. And Prince Edward County, Hastings, Prince Edward, has higher incidence of chronic health conditions and also of amputations than the provincial average. So that puts more pressure on our local healthcare system. Also, mental health issues are prevalent, and there's not nearly enough infrastructure support available. And so while that has affected all age groups, the pandemic in particular was particularly difficult for the youth age group. And there's pervasive feelings of hopelessness in that age range. So housing, looking at house prices, like we're all aware that house prices here have really escalated. And if you look at since 2010, a single residential house sold for a median price of 225,000 has escalated up to 687,500 by 2023. But yet local incomes have not nearly increased at that same rate. So local home buyers are also competing with urban folks who have sold a home in the city at a higher prices and moved to our community. So especially difficult here for first-time home buyers to be able to get into a home. So that's put more pressure. The high house prices have put more pressure on the rental rates as well. You see down here, rental rates have almost doubled between 2020 and 2023. So Prince Edward County's never had a high rate of rental properties, and some of the more affordable ones have also been disappearing because of development. And so some of those apartments have been purchased and undergoing renovations. And so we've lost some of the more affordable housing places as well. Also in Prince Edward County, we've had limited emergency housing options, and our housing department and our municipality is more than well aware of that and is certainly working toward providing more of those. But there's a new transitional housing available at Leeward House that has 9 units, and so that was a progressive step forward. And also Alternatives for Women provides transitional housing as well. So with that, we know that new development won't be able to come up, won't be able to keep up with the needs for housing. And so, and also with affordable housing for sure. So alternative forms of housing are being explored. And if you think about our population here also, about a quarter of our population, I think it's 27% of our residents are solo, live alone. And so that's particularly, difficult for housing for singles because of costs. So alternative forms of housing, there's many of them, but examples might be home sharing or co-housing or secondary suites, that type of thing. And so certainly being explored, lots of work going on, funding applications being submitted. So a lot of work being done in that direction. So new housing developments and affordable housing. So the municipality has in their planning department, they're looking at about 4,200 new housing starts by 2032. And those are imminent housing starts. They have many more in the planning stages than that. Those are the ones that are imminent. Half are shovel ready at this point in time. So those are housing developments that are most likely to happen. So think about that, just to put that in perspective, 4,200 new housing developments by 2032. And that's just the first stage. There's about 4,000 or 5,000 more in the planning stages after that. So currently Prince Edward County has just over 11,000 permanent households. If you add 4,200 more to that in that short a period of time, that's a 37% increase in our households in that period of time. Well, safety. So good news is that our crime severity rate is very low compared to the Ontario average. And that means that the type of crime, we don't have as much violent crime in general in this community. Most of the police time in Prince Edward County is actually spent on more social type of issues. And so we have, for example, high rates of fraud, and our senior population is particularly targeted for that. And just to give you an idea, and much of fraud isn't reported. It's estimated that only 5 to 10% of fraudulent cases are actually reported because people are embarrassed. So in Prince Edward County in 2023, reported was over $815,000 in loss. So fraud is significant. In this chart at the right shows in 2023 the rates compared to the 9-year average. So if you look at fraud, there were 178 reports in 2023. So that's up 111%. So impaired driving is another one of great concern. There were 86 charges in 2023. That's a 144% increase. And the police attribute part of that increase to increased presence on the roads with ride checks and that kind of proactiveness. Also, citizens reporting. And just a note on the impaired driving. Some people might think that it's largely tourist related, but it's not. It's mostly local and regional residents who are being charged. A lot of the tourists seem to be better prepared possibly for making arrangements for ride homes if they've had a drink in the evening. The other concerning type of incident in this community is intimate partner violence. And although if you look on that chart, there's basically been a 0% change in the last 9-10 years. It's remained consistently or on the average about 227 reported incidents in a year. So in other words, the police are responding to about 4 incidents a week of intimate partner violence. And those are just the ones that are reported. There's, a lot of in between that probably isn't, that the police are not aware of. So the other types of crimes would be, for example, drug crimes, which isn't high in this community. There were 27 incidents and charges in 2023. Mental Health Act incidents have increased. There were 160 incidents in 2023. One of the things that's helped tremendously with Mental Health Act incidents is that what's called an impact team that's working with locally OPP. So that's mental health counselors who accompany the police. And so that has really helped to prevent a reoccurrence. And there's more follow-up, and those folks can give more help to those in crisis. And so just an example, there was a lot of them are recurring. And so one incident, there were 24 incidents, I think, from one individual over, I don't know, a 6-month period. That went down to 6 incidents in the next 6 months, just because of the help of those counselors. So that's been highly successful and really addresses the problem much better than, the police could do with their resources. And so also note breaks and enters. Break and enters have really reduced significantly. It's gone down 73% over that 9-10 year period of time. And that's really due to the regional street crime unit. So our OPP works with a regional unit to address that. Many of the break and enters were not from local residents, but people coming into Prince Edward County. So that's good news. So the Community Safety and Wellbeing Plan, that's through the Police Services Board, but it's local community organizations who work with the police to help with priorities in all of these areas. So transportation. Prince Edward County is a really challenging area to serve for transportation. And we have about 77% of our population lives rurally. And there's about 1,200 kilometers of roads to maintain, and that's on a low density tax base. But public transportation has to continue to try to keep up, knowing that we'll be looking at population increases. So if you consider, if we look at just in the near term, 4,200 new housing units, that could potentially add over 2,000 cars to our roads. You think they're congested now. So public transportation is really trying to provide more adequate public transit for residents and families and workers. So some of the things that County Transit, along with a lot of help from the municipality, has been able to recently do is County Transit is now connected to Google Maps. So if you're trying to make connections, both within the county and outside of the county, to County Transit, you can see it now through Google Transit Maps. And another coming soon is an on-demand door-to-bus stop service, and that'll be available through a phone app. And that'll be open to everyone, not just those that require specialized transit. So some big steps forward. And also with changes over time, the electrical, the EV infrastructure is certainly, with our Canadian government's goal of 100% electric vehicle sales by 2035, that has implications certainly for the infrastructure and the grid capacity for electric vehicles. We're seeing those chargers throughout the county, more and more places. And some good news, I'll end up on this presentation with a good news. And Duarte, I know that you're in this presentation today, so as a business rep, this one will be of interest to you in particular. So fewer residents are having to travel outside of Prince Edward County for work now. So if you look at this bottom graph, in 2006, only 40% of our local residents were able to commute locally. In other words, to work locally in Prince Edward County. And by 2021, it's now, at that point, 58% of people are able to find work locally and commute locally. And honestly, it's a beautiful commute. It's so much better than city commuting, that's for sure. So end on a high note. And Dom, over to you.
That's great, Anne. Thank you so much for all that information. I know it was a lot to take in. So at this point, I just kind of want to talk a little bit more about the County Foundation and how we're taking all these areas and the three main business activities that we conduct. So there's three main business activities that the County Foundation works in. One is creating vital signs reports. So thank you for taking part today and engaging in the information. That's a big part of the work that we do. And that's why we want to make it accessible, easy to understand, and communicate so that we can create action through that. So as mentioned earlier in the presentation, we've been doing this since 2013. And I don't anticipate stopping that anytime soon. So it's something that we want to continue to invest in. The other area that we work on is developing charitable funds and facilitating grants to move action forward. So we have a number of funds with the County Foundation. Happy to say that we're managing over $10 million currently, and we have about 40 funds under management, and we've been able to grant into the community over $7 million since 2008. And that's all been in terms of empowering our charitable organizations to do the great work that they do. And then the third thing that we do is we collaborate. So we know that we can't tackle it all on our own. Nobody can, and more minds are better than one. So we act as a convener, bringing people together and helping to facilitate action through groups such as that. And as Anne mentioned earlier in the presentation, we've been involved in the Youth Collective Greater Than, around education, Food Collective, Getting Around Transportation Collective to get some transportation in the county, and most recently Thrive PEC under the economy. And we've been able to help facilitate over $2 million into those collective action projects. And then another new announcement that I think some of you may be aware of, but new in 2024, we have a new fund that is related to vital signs, and we call it very aptly the Vital Impact Fund. So now that you have the data, the next part is you might need some funding to do something with it. So this is a signature fund at the County Foundation. It's something that we're going to be running annually. So for those of you that are thinking, I may not have an idea this year, that's okay. Percolate on this and it'll be open again next year. The concept behind this is to lead with the data first. So read the report, ruminate on that. And then if you have a project or cause and you are a charitable organization or qualified donee as defined by the Income Tax Act, you're able to apply for funding through the County Foundation, through the Vital Impact Fund to move that forward. So we have about $200,000 that we are going to be facilitating through this fund this year. And we've heard the feedback. We're trying to be as flexible as possible. So in terms of eligibility, you'll see that there's very few things that we will not fund under this bucket because we know that so many other funding programs are very prescriptive. They really try and pigeonhole groups into a certain type of activity where we're trying to give reins to the organizations to tackle these issues. So in terms of the goals, we're looking to utilize vital signs data to inform decision-making and fulfill those gaps in community need and direct support where it's needed most. We're looking to support organizations and programs that have strong plans, visions, and ability to move the needle on key issues that were identified by vital signs. And we're hoping that this will serve as a positive catalyst for impact in Prince Edward County. So if anybody would like some more information about that fund, I will pop the information into the chat. We also did a webinar on that new granting fund, and we are available to answer any questions that you may have about that fund. And then we can't do this work without support. We do require support as well. So thank you to our Vital Signs sponsors, the Municipality of Prince Edward County, Wilkinson and Company LLP, Connor Clark and Lunn Private Capital, Base 31 and PEC Partners Inc., and Community Foundations of Canada are all proud supporters of our Vital Signs program. Great. And then last but not least, before we go over to questions, we like to have a call to action. So you've heard the information. How do you make a difference? So the first thing that we recommend is share the information because knowledge is power. So share it with everybody that you have in your networks. This is a digital report, so you can share it on social media and interact with it however you see fit. Discuss the information. It's one thing to listen, it's one thing to share it, but where the action really comes from is digging into it and talking about it. A couple other things that you could do, you could volunteer. Volunteer with a group that is working to address these issues. Not only is it going to help move the needle forward, but we do know that it's better for your health as well. So there's a double impact for you for volunteering. You could contribute to a fund that supports Vital Signs priorities or to an organization that's in our community that supports initiatives. Or you could also create a fund or make a bequest with the County Foundation to move this forward in a financial mechanism. So lots of ways to get involved. And with that, our favorite part, Anne, we'll go to questions and answers. I already have one in the works, so I'll read that out while people are thinking, and that might get the juices flowing. So here's the first one, Anne. Has there been any thought to increasing food education in the county? Prince Edward Learning Center has good food markets, which is healthy food at a reasonable price, but many of the individuals who might be food insecure do not use the service. How can we change food habits away from fast food, which is expensive, to more healthy and less expensive alternatives? So how do we encourage utilization of that program, I think is the underlying question.
That's a good question. And there were quite a few initiatives happening before the pandemic. That really stopped a lot of good things from happening, and they're still just getting picked up. But there were cooking classes, and people were enjoying those immensely and learning food skills, learning how to, for example, can prepared food from scratch. And there's that's starting to happen again on a slower basis. I know the County Food Hub also has had cooking classes for kids, and that's really for youth. That's a really good time to be able to help them learn those skills as well. So I'd love to see more of that kind of thing happening. And you know what? That might be a good project for the Vital Impact Fund.
Yeah, absolutely. That could be a great initiative. I think the other piece about that is we need to remove the stigma from programs like this. I think even with the fresh food market, we have a lot of people that are thinking, oh, I can't utilize that. It's for, those that are using the food bank. But if we encourage more of an equal access, everybody is learning how to cook and prepare nutritious food, people have access to food, perhaps that stigma would be reduced. But overall, it's a really great question. And if you have the answer to that question, I would be very interested in hearing from you. We have a couple in the queue. I'm going to start first with Renia Tominski. She has a couple of questions regarding the age gap in education, literacy issues. So Renia, if you're still around, yes, you are. If you'd like to unmute yourself, please go ahead and ask your question.
Okay, the first one I have is about the intergenerational age gap. And conventionally, Canada has depended on newcomers to fill that in, and we still are, but now there, of course, are issues around eligibility of newcomers to get to Canada. So locally, Loyalist College has been doing its best to fill that gap, but they're going to be impacted just as every other educational institution is. It's a good sign that the co-op students from the health program are coming here, but whether or not they'll be allowed to stay in Canada is an issue. So my question about that is whether there are any moves or conversations around that happening in the county in terms of making this place accessible to newcomers to come and live and work here.
Yeah, thanks, Renia, for that. Certainly, that's been on the radar, particularly, I think, in this last census period, because we've seen greater racial diversity here, and more newcomers in general trying to get acclimated and welcomed in our community. That was a particularly difficult time, I think, for anybody who was trying to move into here. And so looking at more ways, and Thrive also looked at what are more ways that we can welcome and provide appropriate cultural materials for newcomers, for new residents as well. And so there's work being done. I know that the immigration, Quinte Immigration, also has been attending some of our meetings as well and providing resources and some ideas for us. And so I'd love to see. And the library does a wonderful job too, welcoming newcomers and trying to provide resources for them through the Newcomers Club. I'd like to be able to contribute to that too with more resources for new residents. Thrive had some great ideas in that when we did community asset mapping. So I'm not sure if anything's has been formalized in that direction, but it's on the radar. So that's good news. It's likely to see action.
The second question was about literacy, because both of these are areas that I'm involved in. And Tyendinaga, for example, has some projects on the go with the building of a new school, for example. And in general, First Nations communities are really moving ahead with outdoor education possibilities for people and informing people about the importance of outdoor education. That's a tremendous asset that we have around here. And I'm wondering if in terms of environmental possibilities for education, I'm just wondering if that's something that the school board is looking at all, because it's been shown to have a lot of really positive impacts on learning right across the board, whether it's math literacy or language literacy. So I'm curious about whether any moves are being made in that direction.
Yeah, absolutely. Europe seems as far ahead of us, in that regard, for sure. My youngest sister went to school in Finland for a while, and the dramatic difference, in the approach to outdoor education. I can't speak on behalf of the school board. I'm not sure of the initiatives that are happening there, but that would be an interesting topic, Renia, to follow up on.
Thanks.
Great. Thanks, Renia, for that question. We have Beth and Bev with their hands raised. I didn't see who had it raised first, but I see that Beth still has her virtual hand up. And so, sorry, Bev, did you want to unmute and go ahead, and then we'll go to Beth next?
Sure. You want me to go ahead?
Yeah, please.
Okay, great. Thanks. So I'd just like to speak to the question with regard to food education in the county. How do we change food habits away from fast food? Education is the biggest piece, right? How do we educate individuals to steer away from their current food habits, which may not be very healthy, and get them away from fast food? So education, I think that starts in the school system, educating from a young age. The cooking classes, yes, absolutely. The other thing that I'll add to that, and I'm going to tout the program that my program coordinator, the Good Food Box that we offer here at CDC. We serve all of Hastings and Prince Edward, and we do have a partnership with the hub in Picton that allows anyone in Prince Edward County the availability to purchase, fruits and vegetables at less than wholesale costs. So, it's about a 40 to 45% cost savings to a family if they're using the program through the hub. It's a monthly program. So as long as they reside in Prince Edward County, they have access to that program. It amazes me the number of families and individuals who are not aware that the program even exists. So again, back to the education piece, promotion with our community partner. If they are aware that the Good Food Market is available in Prince Edward County and they're using that and then piggybacking with our Good Food Box program, the amount of money that the family will save will be significant, as well as increasing awareness of healthy eating. And if you start at a young age, then, that's going to hopefully balloon into healthy adults as well. So that's just my 2 cents on that. Thanks.
Thanks, Bev. Really appreciate that. And Beth just put her comment in the chat. I'm going to read it out just for the purposes of the recording. So Beth is speaking from the perspective of Reaching for Rainbows, which is an organization locally that supports young girls and women in terms of leadership opportunity and development. So she's just saying she has some thoughts on the food education question as well. She thinks that folks who might need it most, based off of what they are hearing at Reaching for Rainbows, is that the timing doesn't work. So many parents don't have time to access those programs in the market just between work and shuffling kids around. So there's a major barrier there in terms of access. And let's be honest, fast food is really convenient. That's the one benefit that they have, right? So thank you for those comments, Beth.
Sorry, I actually just had a thought too, like when
Please.
Bev was talking about like a stigma, because I think Anne had said something about stigma, and I'm just wondering if the challenges around like people knowing that the service exists in the community is that you're expecting them to come to you at your organization. I think is that where the market is hosted at like at your organization? Because if you go out into the community where people are, you might have more success with people knowing about the program as well. Just a thought I had.
Yeah, no, it's a great piece. So partners of ours, the Prince Edward Learning Center, host the Good Food Market, and they have 3 locations. One is hosted in Picton, which is out of their office, one in partnership in Sophiasburg at the public school through the County Food Hub, and they have a new one that's in Consicon as well.
Can I just add one more thing to that?
Mm-hmm.
With the Good Food Box, the orders, everything is pre-ordered and prepaid, and then we deliver those orders right directly to the hub in Picton, and then individuals who have pre-ordered and prepaid then pick up their order. So we really strive on trying to eliminate any barriers that we can and doing community outreach. So even though the food is being packed in Belleville once a month to go into Picton, we go into Picton, right? So we eliminate that transportation barrier to the family. But again, the other thing is once anybody orders, anyone can pick up on their behalf. We understand that life happens. So if there's whatever going on in that family's or individual's life at that particular moment, anyone can pick up their order. So we try to make it as simple as we possibly can, if that makes sense.
Yeah, that's great. Thanks, Bev. You're really looking to meet people where they're at, which I think is what Beth was saying as well. Perfect. Reg has asked for some more info on the Good Food Box program, so I'm going to pop your website into the chat so that that people can take a look at it. But definitely go to the CDC's website. There's lots of information there. They've got boxes that support fresh food, and then also boxes for babies, infant formula, etc., which is just a wonderful, wonderful service. So I'm just going to pop that information there. Does anybody else have any questions about the vital signs data or the stats that were relayed in the report? Is there anything that we want Anne to dig into? Pausing for a second here. Okay, it looks like everybody's still digesting, which is fantastic. So thank you all so much for joining us this afternoon. I really appreciate you taking a vested interest in the data of Prince Edward County. And I don't know if you want to offer any closing remarks before we sign off.
Sure. Just briefly, I'd just like to say sometimes it takes a while to digest that. And if questions come to you later, or if you want me to dig further into some of those points, please don't hesitate to contact me. Fairly easy to find through the County Foundation website. And please to help with any things that you have like that for the data that we have available. We continue to dig and try to find better data continually. It's challenging in our low population area. We don't have as much data available to us as, for example, even neighbors like Belleville, for example. But we're finding each year that we're requiring better sources of data, and it's always helpful to have feedback from folks like yourself about what data is useful. So anyway, always pleased to try to answer questions that you may have.
Perfect. One more quick question snuck in here. Thanks for the good overview. Is a hard copy available?
Dom, did you want to address that one or me?
Yeah, sure. So we do not have hard copies available at this point in time. Printing copies of the reports, I'll just be perfectly honest here, it is costly. It does take some resources to do that. So we aren't printing mass copies every single year. We were looking to print a few copies for 2024, but have run into some printing issues. So we are looking to have some of them printed, but in an effort to be prudent with expenses, and then also looking at the environmental footprint, we're trying to really encourage downloads and online versions of the report. But if somebody would really like a printed copy, once we have them available, we will make sure that you get one. Great. Well, thank you very much. Appreciate your time, and have a wonderful afternoon. Bye now.